Hi, my name is Stephanie, and today I want to talk to you about nonverbal learning disorder, which is abbreviated as either NLD or NVLD. This was actually introduced to me by one of my viewers, and they asked me to look into it as they have it, and I had no idea quite what I was getting myself into when I started searching about this. So to begin with, NVLD or nonverbal learning disorder is not an official diagnosis in the ICD-10 or the DSM-5, which are the major diagnostic manuals. However, the ICD-10 does have a diagnostic code that people might put this under, which is kind of like an unspecified learning disorder kind of grouping. And within those codes, there's also something for visuospatial deficits, which is a core symptom or core part of NVLD. Something else to note before we get any further is that despite being called nonverbal learning disorder, it's not that the person themselves is nonverbal, but rather they have difficulty with things that aren't verbal, if that makes sense. So like nonverbal body language, for example, is difficult for people with NVLD. Now, despite not being technically included in the ICD-10 or the DSM-5, a lot of people have been diagnosed with this. Additionally, one source estimates that about 5% to 10% of clinical populations present with NVLD. The earliest description and use of the term nonverbal learning disabilities actually dates back to 1975. Yet this condition has struggled to be properly defined and arguably often gets mistaken for other diagnoses because of the symptom overlap. Additionally, there are arguments of whether NVLD is a thing or not, or if it's its own thing or not. So let's look at the common symptoms or traits of NVLD to make clear why we're talking about this on a channel about autism-related topics. According to an article hosted on ADDitude or ADDitude, the following are commonly reported symptoms of NVLD: trouble recognizing nonverbal cues, facial expressions, body language, early speech and language acquisition, talks like an adult from a young age, poor coordination, seen as clumsy or always getting in the way, poor fine motor skills, difficulty using scissors, tying shoes, etc., always asking questions to the point of being repetitive or interrupting the regular flow of conversation, needs to verbally label information in order to understand it, difficulty comprehending unsaid or spatial information, visual spatial difficulties, discrimination of differences of objects, visualization of images, determining one's location of body in space, extremely literal, struggles with sarcasm, innuendo, or other linguistic nuances, naive or overly trusting, difficulty coping with change, trouble following multi-step directions, difficulty making generalizations or seeing the big picture, overall challenges often masked by highly advanced verbal skills. Now, a great many of those can be considered traits of autism, and before the change in the DSM-5, specifically traits of Asperger's syndrome. And some of these traits also do overlap with ADHD. Thus, the research on NVLD has a lot to do with comparing what they see as NVLD with ADHD, and specifically Asperger's or high-functioning autism. The articles that I ran across did not ever really include anyone on the autism spectrum who is not considered to the research team to be considered either meeting Asperger's criteria or high-functioning autism. I do imagine that this is due to the verbal component of NVLD. This research is partially hindered by the fact that there's no universally agreed upon definition of NVLD. So different people might see NVLD criteria differently according to different research papers. However, one of the main factors that everyone does seem to agree on is the deficit in visuospatial abilities. A paper evaluating the research done on NVLD actually mentions this confusion and the research that is involved in the field. Taken as a whole, this body of work has yielded considerable confusion. For example, some have found that the NLD profile is consistent with Asperger's syndrome and high-functioning autism, while others have suggested that the profiles are distinguishable. Many children diagnosed with NLD eventually meet criteria for attention deficit hyperactivity disorder. Additionally, the paper discusses the researcher who is kind of the pioneer in the field, Byron Rourke, and his work, which has explored NVLD features in many different conditions. Roark has characterized children with NLD as having strong verbal skills and tactile visual deficits that subsequently affect attention, memory, problem solving, and social competence. He developed a neurological hypothesis for NLD known as the white matter model. Roark widened his research to include subsets of children with genetic and medical conditions to provide validation of the hypothesis that disturbances in the integrity of the myelinated fibers of the brain might be related to symptoms of NLD. Roark and colleagues have identified neurological syndromes such as fetal alcohol syndrome, traumatic brain injury, and Asperger's and Turner syndromes as disorders for which the phenotype is likely to include features of NLD. Roark 2002 and others have also used the NLD syndrome to describe children with no apparent congenital or acquired neurological disease. So while Roark has kind of sketched out a profile for NLD or NVLD as people having strong verbal skills, but tactile visual deficits that basically affected executive functioning and social competence, he also kind of identified a bunch of other conditions that have these traits too. Additionally, he and others have described children as having NLD who don't have already existing conditions that they're aware of. So as mentioned, he did hypothesize an idea called the white matter model, where issues with the myelin that's on the neurons might lead to NLD. Others have also suggested there might be issues in the right hemisphere of the brain because of the types of deficits and strengths they're seeing in those with NVLD. I wasn't finding a lot of useful follow-up information on this particular theory until I came across an article that was published in 2017 in which they actually used MRI and did find evidence that the white matter, which is the myelinated part, does seem to have some dysfunction in the right hemisphere, and there might also be issues in some of the gray matter as well. However, beyond that particular one, I'm not seeing a whole lot that delved deeper into actually verifying the white matter model, although it is mentioned as a hypothesis or a theory in quite a few papers. Now, with all these overlaps in symptoms, again, people aren't sure. Is this Asperger's? Is this a part of the autism spectrum? Is this actually part of ADHD? Or is this its own thing? So people have turned to neuroimaging, and a lot of the research that I found involving NVLD had to do with brain scans. We want to see, are these brains looking different than these other conditions? One study found that those considered to have Asperger's syndrome had a larger hippocampal and amygdala volume compared to the NVLD and control groups. Additionally, both the Asperger's group and the NVLD group had a significantly smaller anterior cingulate cortex when compared to controls. While the study wasn't exactly huge, about 26 people per group, it still gave an interesting insight to differences in the brains of people in each category, especially in regard to the amygdala and hippocampus. The researchers also noted that those with NVLD don't seem to have the same level of anxiety that those with Asperger's do. In regard to the anterior cingulate cortex, or the ACC, ADHD is also known to have a smaller ACC, such as was found in those with Asperger's and NVLD. Another note they made was that they didn't see a significant difference in caudate volume, which they found surprising because all but one child technically would meet the criteria for having ADHD in the NVLD group. I'm going to assume here that those with ADHD typically are considered to have a difference in their caudate size, considering the researchers were surprised by this information. Other studies found differences in visual spatial skills in children with NVLD while not finding a difference in the Asperger's, ADHD, or control groups. This is suggested as a possible differentiation between Asperger's and NVLD, and they do mention this is a hotly debated topic in their field. Yet another MRI-based study found that children with NVLD had a smaller splenium than did so-called high-functioning autism and ADHD. The splenium is a part of the corpus callosum that helps connect the two sides of the brain together. Overall, however, they didn't really know any difference in the size of the corpus callosum as a whole between any of the different groups, which included NVLD, high-functioning autism, ADHD, prominently inattentive type, ADHD combined type, and a control group of typically developing children. They also noted that those with high functioning autism had a larger mid-body than those with NVLD. Now, I know that's a lot of information, and a lot of that might be pretty much meaningless to you if you're not really sure what those things are about or not really familiar with the brain. But basically what I want you to take away from that is they did a bunch of brain scans and were looking for differences in the types of brains of conditions that have very big symptom overlap. And they were seeing some differences between the groups. Basically, they're trying to distinguish the difference based on neuroimaging instead of just symptomatology, because clearly there's such an overlap, it gets very confusing. So they wanted to see, is there actually a difference going on in the brain? And they were seeing some differences, and it does lend support to the concept that NVLD might be its own thing. A group called the NVLD Project supports the idea of NVLD as separate from autism. They address this in their FAQ page on their website, but the people who responded to that particular question gave kind of a less than satisfactory reasoning in their reply, addressing the question of if they feel that NVLD is distinct from autism and how to try to demonstrate this to those who think it's an autism spectrum disorder. They essentially say that it can be distinct even though they have similar social issues and difficulty with cognitive flexibility. They then go on to say that the old Asperger's diagnosis had noted issues with visual spatial problems, and that they feel it's a loss to those who felt the Asperger's profile fit them because they lost a community they could relate to. Kind of a weird deviation from the topic, but okay. Then they conclude that although there's no good data on the subject, they find that those with NVLD tend to at least express more desires to have social relationships than those in the Asperger's or now high-functioning autism groups. That's a really terrible way of trying to differentiate the two, in my opinion. It's based off of anecdotal evidence, suggests that high-functioning autism is a diagnosis in the DSM-5, which it's not. And overall, it's kind of insulting. I'm not really a fan of the reasoning, well, they can be distinct, and Asperger's mentioned visuospatial issues. Isn't it sad that Asperger's is no longer considered distinct? Also, people with NVLD just seem to express that they want to connect more. That's just I'm sorry, that's just not great reasoning. Now, on a different part of the NVLD Project's website, they mention a much more useful difference to point at, noting that NVLD doesn't include deficits in verbal expression and involves motor difficulties and challenges reading body language rather than stereotyped or repetitive movements. Now, to be fair, autism also involves motor difficulties, but this particular distinction here interests me because I have had people reach out to me and ask me, can you have autism and have all these traits of autism, but not have stimming behaviors? Not really have stereotyped behaviors that fall under stims that aren't just everyday, everyone does this kind of stims. With NVLD appearing so ridiculously similar, and if it is indeed its own condition, this could be an answer to why some people are experiencing this. Now, this area really needs more research. There are cases where people with NVLD are diagnosed with ADHD, like that one study where every single one of them except for one met criteria to be diagnosed with ADHD. They could be prescribed medication that's supposed to help them, but doesn't because they don't have the thing that's causing ADHD. Larger studies would also really help with the concept of neuroimaging. I think that they should include autistic people who don't meet the old criteria for Asperger's as well in these studies. I get that they were curious about the overlap, but I think there's value into broadening this look, especially if you're trying to argue that NVLD isn't just a part of the autism spectrum. And then in the case that NVLD gets recognized, then treatment options or support options or whatever else can be looked into to help these individuals. Apparently, some with NVLD complain that programs that were supposed to help them were more geared toward autistic people. I'm actually quite interested in what the difference is, like what exactly about the therapy that was supposed to help them as well wasn't meeting their needs because they're not autistic, and I'm just curious how that works. And I think that would actually help not only for therapies to improve, to be distinguished between NVLD and autism, but for us to understand the differences between the two. If someone is experiencing things that aren't being catered to them properly, maybe that is going to reveal a difference that we're not maybe aware of right now. So have you heard of NVLD before? Do you think that this is something that should be included in the spectrum of autism spectrum disorders, or do you think that this is its own thing? Let me know your thoughts in the comments below. Thank you for watching today. If you enjoyed it, found it informative, or whatever else, you can go ahead and hit that like button. And if you're interested in autism-related content from me, you can go ahead and hit that subscribe button. I try to upload every Thursday at 4 p.m. Central Standard Time, except for the last week of the month, where I do often try to go live with you. Thank you to everyone who supports me here on YouTube as YouTube channel members, through Ko-fi, and as patrons on Patreon. And a special thank you to my Spinny Stimmy tier patrons, Jack Varney and Philip Noah. Thank you so much for watching, and I hope that you have a wonderful week. Bye!